Hi dear listeners, welcome back again for our presentations. We are continuing with our priorities. Today we are doing HIV part 2. We have seen part 1, we have seen the definition, we have seen the sign and symptoms. Let's see what is going to be the next topic, which is going to be consequences or complications of HIV. HIV does not only have complications on the physical body, it does also have complication on the social aspect, epidemiological aspect, financial. Let's browse and see. In short, we are going to start from the head till the toes. When you check the complications from the head, HIV can cause abscesses. Abscesses in the brain, you can see where they are located here on a CT scan. It can affect the eye. It can affect the eye. Sometimes it causes tumors in the form of cancer. It does cause what you call HIV-related retinopathy. It does affect the ear, whether internal or external, but this one is a malignant otitis externa. It does destroy the inner part. It's a malignant. You treat it, it's over and over, it's a recurrent one, does not really respond well with treatment once it is malignant. It does not spare the mouth. You can see what we call the oral candidiasis. Oral candidiasis, you see the palatine side, the tongue, it is affecting the tongue, the cheeks. Sometimes it goes deeper in the esophagus, what we call esophageal candidiasis. Sometimes it causes more serious lesions in the form of tumors, which we call Kaposi sarcoma. You can see it is affecting as well the gums. It does affect the heart. You will hear what we call HIV-related cardiomyopathy. It will affect the muscle of the heart. That's a complication once the stage of HIV is advanced. The lung, particularly when TB is involved. HIV, around 70% of cases, it will go with TB. This is a chest X-ray, which is showing the upper and the middle lobe of the right side, right lung, as well as the left lung. They are affected. There are some cavitations. You can see when we talk about TB in the context of infection of HIV, there are some infectious agencies that come when HIV is in place, when the immune system have been lowered. Others are non-infectious. Among the infectious ones, we can note bacteria, mycobacteria like TB itself, and PCP, used to be called Pneumocystis carinii pneumonia. Now it is PGP, Pneumocystis jirovecii pneumonia. Viruses and fungus. These are infectious that would take advantage and infect the lung. Among the non-infectious ones, you find malignant and non-malignant ones. Among the malignant, you find Kaposi sarcoma, you find lymphoma, you find solid tumor, and others. So now the other part of the lungs which will be affected is pleural effusion, which comes with TB, or empyema. You can see this lung. When you see this lung, you see the air through the both sides, but when you see the right side of this lung is almost fully obliterated. There is no air at all. This is a very massive pleural effusion. It's a very bad one, and it can cause very serious complications and even death to the patient. Then the kidneys, HIV-related nephropathy. It can even lead to renal failure. We know the kidneys are very important to eliminate the toxins. Once the toxins are stored in the body, then we have the serious consequences. Does not spare the lymphatic system. We know lymphatic system does help a lot when it comes to fight infections. Normally we have lymphoid organs, and these nodes, normally they are not palpable. You cannot feel them unless there is an infection going on where they come now to fight, then they swell. You can see now here, these are the adenopathies. The lymph nodes are swollen. These are inguinal adenopathies. Subclavicular, they will be there. Subaxillar. Sometimes in the abdomen you find lymph nodes inside. The spleen will swell. Those are the different conditions that would come with the advanced stage of HIV, with on the skin Kaposi sarcoma as well. Those are the complications that we can observe. It does cause serious lesions on the genitals. Why? The immune system, once it is lowered, it goes down. Any bacteria, any virus will take advantage of the lowering of the immune system. Now, these are just few of the lesions that can affect and infect the female part and male as well. Not on the physical part now, on the social aspect, which is a very sad situation to face. If a mother or a father dies in a family, children will take over. They become fathers and mothers of the family prematurely. It leaves serious pain in the families. Not only that, if it takes one partner, you will remain with a widower or a widow. That's very painful in the many families. Now, TB itself, which moves with HIV at a ratio proportion of 70% of cases, it's affecting mainly sub-Saharan Africa. You can see, you can draw a very clear line. If you compare the upper part of our globe, and you check South America, you check Australia, you check Asia, you see sub-Saharan Africa is a red zone. It's a message itself. This is a serious threat to African people. If you see the numbers that you can count in Southern African countries of people infected with HIV compared to other part of the world, other continents, you can see here in the Middle East and in North Africa, they were having 230,000 of infected people in 2016, while in Southern African, we are having 19.4 million. We need to ask ourselves, what is going on? What needs to be done? What do others do that we are not doing right? When you check the statistics of just 2019, not long ago, there are 24.5 million of people who are on antiretroviral therapy. In the end of 2018, almost 38 million people globally were worldwide. They were living with HIV. These are the recent statistics. They are not long. And when you check the infections, what we call the incidence, the new cases, in just 1 year, it's 1.7 million, the new cases. And when you check people who died due to AIDS-related illnesses in 2018, it is 770,000. People who became infected with HIV since the beginning of the epidemic, and now it's pandemic, but mainly endemic now in sub-Saharan Africa, we count almost 75 million. One can understand and imagine how many lives, how much resources lost during this period of almost 40 years. People who have died from AIDS-related illnesses since the start of the epidemic. The up is the people who were infected and the people who died. 32 million. 32 million, it's a significant big number. People living with HIV in 2018, the 38 million, and 36 out of these 38 million were adult, and those who are below 15 years, they are approximately 1.7 million. And and when you check people living with HIV who knew their status, they are 79. Almost what? 80%, meaning 20% do not know their HIV status while they are infected. And about 8.1 million people did not know their HIV status. They did not know that they were living with HIV status. Now, when we check HIV and the woman, this is a specific issue that is really having a significant impact on the society. We know women are important people in the society. They are the ones who educate the society. But once they are not protected, it is a problem. We can see here that every week, around 6,000 young women aged between 15 to 24 years become infected with HIV. In sub-Saharan Africa, 4 out of 5 new infections among adolescents are between 15 and 19 years. These are girls, teenagers, and 4 out of 5 new infections are recorded. And young women aged between 15 and 24 are twice as likely to be living with HIV compared to men. So if you see teenagers and young women from 15 to 24, if you have like 10 young girls who are HIV positive, it means male counterpart will be 5. We need to ask ourselves, why is it so? Are women protected? What are the factors and how to address it? Impact on the global global side on HIV. We are talking about worldwide now. The implication, the negative implication, the consequences and complications, it does decrease life expectancy, and it does cause a reversal of a child survival again. It does increase the number of orphans, and it does overstrain healthcare systems, and a negative economic impact on countries. We can imagine how much billion spent on managing these conditions in many African countries. We can understand how it is blocking the development. Now, when we check this issue, the only route is for us to come together, keep on emphasizing on education, and we do health promotion. This is not a conclusion. We still have more topics to come where we have to sit together and analyze. please, let's do this together. Let's come visit this website, or you can share your ideas by sending an email. This is the email address provided. Thank you so much. Yeah, way.